5 natural ways to lower blood pressure. Stable blood pressure. Hello. If you or a family member has suffered from the pressure or want to have your blood pressure controlled, this video may be very important to you. In this video, you will discover 5 natural and effective ways to have your blood pressure at its optimum point. It is better to foresee than to suffer the consequences that can originate high or very low blood pressure. So we started. In this video, we are going to teach you the 5 best ways to control your blood pressure naturally, all without complicated processes or dependencies on painkillers and medications for life. Hypertension, commonly known as high blood pressure, affects 1/3 of all adults in the United States, and less than half of the people with high blood pressure have it under control. High blood pressure can cause serious health problems without showing any warning signs. When your blood pressure is too high for too long, it puts you at risk for heart disease, stroke, kidney damage, or an aneurysm formation, explains Colin A. Kraft, MD, physician at Penn Heart and Vascular Center, Washington Square. The good news is lifestyle changes can help you naturally lower your blood pressure. How to lower blood pressure naturally. 1. Regular physical activity helps improve health. It is no secret that regular physical activity helps to keep you in good health. Not only does exercise help control high blood pressure, it also helps you manage your weight, strengthen your heart, and lower your stress level. Try to aim for at least 150 minutes of exercise per week of moderate intensity physical activity, such as brisk walking, says Dr. Kraft. While any type of aerobic activity, walking, jogging, dancing, has a positive impact on heart health, try to find something you enjoy doing. This will make it easier to commit to a regular routine and will motivate you to get up and moving. 2. Eat less salt. Most people eat too much salt without realizing it. The American Heart Association estimates that the average American eats about 3,400 milligrams of sodium a day. However, the recommended daily intake is 2,300 mg, with an ideal limit of less than 1,500 mg per day, especially for those with high blood pressure. Dr. Kraft adds even a small reduction of sodium in your diet can help improve your heart health and can reduce your blood pressure if you have hypertension. To decrease sodium in your diet, try these tips. Read food labels. Look for low salt or low sodium versions of the food and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium naturally occurs in foods. Nearly 70% of the sodium we eat comes from processed, prepackaged, and restaurant foods. Do not add salt. Just 1 teaspoon of salt contains 2,300 mg of sodium. Use salt substitutes such as spices, garlic, herbs, and other seasonings in place of some or all of the salt to add flavor to your favorite dishes. 3. Add more potassium to your diet to reduce high blood pressure. Not only does potassium help regulate heart rate, it can also reduce the effects of sodium in the body. Potassium helps your body get rid of sodium and also eases tension in your blood vessel walls, both of which help to further lower blood pressure, says Dr. Kraft. The most effective way to increase your potassium intake is by adjusting your diet as opposed to taking supplements. Potassium-rich foods include fruits like bananas, melons, oranges, apricots, avocados, and tomatoes, milk, yogurt, and cream cheese, leafy green vegetables, potatoes and sweet potatoes, tuna and salmon, beans, nuts and seeds. While incorporating these foods into your diet can improve heart health, it is important to talk with your doctor about the potassium level that's right for you. Also, if you have significant kidney disease, you should avoid consuming too much potassium because your kidneys may not be able to eliminate it. 4. Limit your alcohol consumption. Some research shows that drinking alcohol in moderation can benefit your heart. However, too much alcohol consumed at one time can cause a sudden spike in your blood pressure. Monitoring alcohol intake is very important. Alcoholic beverages can contain significant amounts of calories and sugar, which can contribute to increased body fat and weight gain, both of which are factors that can lead to higher blood pressure over time, says Dr. Kraft. A drink is considered 112 Oz. Beer, 4 Oz of wine, 1.5 Oz of 80 proof spirits, or 1 Oz of 100 proof spirits. If you are currently taking medication to treat high blood pressure, you should be especially mindful of your alcohol intake. Besides the effect on your blood pressure, alcohol can also reduce the effectiveness of blood pressure medications, explains Dr. Kraft. 5. Reduce your stress to lower your blood pressure. We all have stress in our day-to-day lives. A flat tire in the middle of rush hour, a looming deadline at work that can cause a temporary spike in blood pressure. In most cases, once the stressful situation is resolved, your heart rate and blood pressure return to normal. However, chronic stress may put you at risk for a variety of long-term health issues, including high blood pressure, heart disease, and stroke. Stress can also increase your blood pressure levels if your coping mechanisms involve eating unhealthy food, drinking alcohol, or smoking. While it is impossible to eliminate all stressors from your life, learning to cope with them in a healthier way can make a positive impact on your health and wellness, which can in turn lower your blood pressure. Some methods to help alleviate or deal with stress include reframing your mindset. Focus on the things you can control instead of worrying about situations that are out of your hands. Many times, our anxieties stem from the what-if instances that might not ever occur. Putting those thoughts into perspective and reminding yourself to stay present can help calm those worries. Avoid stress triggers. Try to avoid putting yourself in unnecessary stressful situations. For example, try leaving for work a few minutes early to beat rush hour traffic. Practice gratitude. Acknowledging all the positives in our lives often helps to shift the focus away from what we want or what we are lacking. In addition, outwardly expressing gratitude to others can also help reduce feelings of stress. Take time to relax and enjoy. Carve out time for things that bring you joy. Whether that's eating a good meal, spending time with loved ones, or listening to an interesting podcast on your commute, find time to incorporate small moments of enjoyment throughout the day. It's important to note that if you have prolonged hypertension, your treatment may require both healthy lifestyle changes like these, along with care and medications as prescribed by your physician. If you have found this content valuable, subscribe to our channel to receive tips and strategies that help you. Thank you.